Welcome to this piece where we're talking about CT angiography at One Welbeck Heart Health. So today, I am not only the medical director of One Welbeck Heart Health, but I am the patient, because I wanted to demonstrate what our patient journey is if your doctor decides you need a CT scan. A CT scan is an anatomical test. It'll tell you about what the structure of the arteries are, and less so about the function of the heart. If we wanted a more functional test, we could use something called a stress echocardiogram or even a stress MRI scan, and we can leave it to your cardiologist to decide what scan is best for you. So I arrived on the third floor, which is One Welbeck Heart Health, and was greeted immediately by one of our receptionists. She asked my details, confirmed who I was and why I was here. I sat down for a moment and then filled in a questionnaire about my insurance details or whether I was self-pay. I was then taken through to the ante-room just before the CT scanner and paused for a moment there until someone from the CT scanning department took me in, showed me to the changing room. At that stage, I filled out another form asking really about whether I was allergic to the contrast going to be given, and if I needed a beta blocker to slow my heart rate down, whether I would be okay with having that injection. I got changed and was shown into the CT scanning room itself. I lay down on the bed, very comfortable in fact. Apparently it's slightly curved to provide more patient comfort, and had a drip placed in my arm. I had a blood pressure taken on the other side and an ECG lead attached. And after that, I was told what would happen when I'd go into the scan. I was told about the warm feeling I would get when the contrast was injected, and therefore it came as no surprise. When the contrast gets injected, it's quite cold in your hand, it's being injected in the elbow, and then there's quite a warm feeling all over your body, so that's to be expected. I was told I would need to hold my breath, and there were instructions inside about when to hold your breath and when to release and start breathing again. And the other thing I noticed was that it was a little bit like being in the TARDIS. The CT scanner swirls around you, thankfully encased, and therefore you're not in any danger. But as it spins around, you get the flashing lights that you do when the TARDIS starts to take off or the tube starts to move through an underground station. And then finally I was taken out of the CT scanner, the drip was removed from my arm, and I got to slowly get up in case there was any reaction from me having laid down for that period of time. I got changed, and by that time I was ready to leave the building. So a fairly smooth experience. Once we've had the scan, Ben Arif, one of my radiology colleagues, will have analysed the scan, and then I'll receive the report. There are two parts to the scan. There is the calcium score, and I must say as a cardiologist I don't use just the calcium score. It used to be used when the whole radiation dose for the full scan was much higher. But the calcium score is a number like the cholesterol level. So the calcium score below the age of 50 should really be 0. And if you have any degree of calcium, that's unusual. As you get older, the calcium score rises, and it's calibrated to your age and your gender. Ladies have less calcium, it occurs later, and obviously the older you get, the larger the calcium. So my calcium score has an absolute number, but also a percentile. And that is not a degree of narrowing of the artery. So I'm at about the 60th percentile, which basically means I'm in the middle of the curve for my age and gender. The other part of the scan is looking at the anatomy of the blood vessels. Are they open? Are they closed? And thankfully, the most narrow they become is about 25%. That is not quite as good as 0. I was hoping for 0, but actually you're not going to get any symptoms from those narrowings until they're at least 70 or 80% narrowed. So I'm far away from that. But there's enough plaque in one of my arteries for me to continue the statin that I started over 10 years ago, in fact. So it may have been that the artery would be much worse had I not started the statin. I can't predict that. But we do know that statins don't leach away the plaque that is already there, but they do slow the progression of what is already developing. So my cholesterol level is pretty average, and my ratio of good to bad cholesterol is actually very much in my favor. A ratio below 5 is good, a ratio below 4 is even better, and mine is below 4. So do I need a statin? Well, I'm Asian, I don't smoke, I'm slim, my blood pressure is okay, I don't have diabetes, But should I be preventing trouble in the future? In my mind, the answer is yes. And I do have that one small plaque in my coronary arteries. I don't want that getting any worse, so I'll certainly be continuing the statin. So I've had a wonderful patient experience actually at One Welbeck Heart Health. I think everyone was very nice. All my patients report the staff are very nice here. And actually the whole experience of having the CT scan was very smooth. And the data thankfully has been reassuring. If you're concerned about your health, or you have no symptoms but you're worried that you may develop symptoms or you have risk factors, then please consult us at One Welbeck Heart Health and we'll be happy to help. We'll be able to select the right tests for you. If it's just basic ECG and echocardiography and a set of blood tests, that may be enough. If it requires something more detailed, then there is a large range of tests available and the cardiologist will be best placed to select the right one for you.